Are you suffering from pain for many months? Do you have stiffness in your back every morning? Maybe this is not your age. Maybe this is not related to your previous sport injuries or a car accident. Maybe this is an inflammatory disease of your spine. Have you heard about ankylosing spondylitis? Join me in this lecture to learn how to recognize and what tests are needed to diagnose ankylosing spondylitis. Unfortunately, ankylosing spondylitis is a disease that is frequently missed. Patients get to a specialist after many years of suffering and pain. This video is for educational purpose only and will not substitute medical evaluation by a physician. For any medical advice, please contact your physician. In case of an emergency, call 911 immediately. Ankylosing spondylitis is a type of inflammatory arthritis that can affect the spine, the peripheral joints, and the tendons, but it also can affect other organs like your eyes, your heart, your lungs, or kidneys. Most patients that develop AS are young and their symptoms start gradually over the course of weeks or months. If you want to learn more about the most common symptoms of AS, watch this video in my channel. First, your physician will take a very detailed medical history. As physicians, we are interested if your pain has certain features that are suggestive of inflammation, such as pain and stiffness that can be present primarily in the morning, and that can be ameliorated by movement. There are also other symptoms that we look for, like other joints involved, your hips, your knees, your ankles, or even the hands. If you had tendinitis or inflammation of the tendons, if you had swelling of one finger or one toe at a time, if you ever had inflammation of the eyes, if you had a personal history of psoriasis or an inflammatory bowel disease, and if you have a family history of ankylosing spondylitis. We are also interested to know what kind of therapies you use to ameliorate your pain. Second, as physicians, we do a physical examination and we look for the spine or other joints' range of motion. Sometimes we identify swelling of one finger or one toe, which we call dactylitis. Other times, we do see swelling of the Achilles tendon or tenderness over the elbow tendons. Patients with eye pain or any visual changes will be sent to a specialist for further evaluation. In patients with very advanced disease, we can see a very stiff back or an ankylosed spine. If thoracic spine is affected, then chest expansion may be also decreased. Remember, a normal chest expansion with a deep breathing is usually more than 2 centimeters. If we want to test the lower spine range of motion, we use a test called Schober test. How do we do the Schober test? So this test will measure the forward flexion of the lumbar spine. The patient is asked to stand erect with feet apart to approximately the same width as the shoulders. A mark is placed at the midpoint of an imaginary horizontal line that joins the two posterior superior iliac spines. A second mark is placed as a vertical line 10 centimeters above the first mark. The patient is then instructed to bend forward as much as possible, if it's possible to touch the floor with the fingers, but they have to keep the knees straight. The difference that we measure between the two upper marks in the erect and also forward bend position is measured. The test is usually performed twice to have a better accuracy. A measurement of more than 5 centimeters is considered normal. If the measurement is decreased, then we consider the spine affected. How do doctors test for AS? There are no laboratory tests that will be diagnostic for AS, but there are some tests that will help us in make the diagnosis. First, let's talk about HLA-B27. If you want to learn more, watch this video that will explain what HLA-B27 is, what it means, and how is the HLA-B27 associated with AS. HLA-B27 is present in 85 to 95% of patients with AS. Remember, a positive test for HLA-B27 alone is not diagnostic for AS. And also, a negative test for HLA-B27 does not exclude the diagnosis of AS. HLA-B27 positive needs to be evaluated in the clinical and radiologic context of the patient and does not make the diagnosis of AS. Let me give you an example. If a patient has 3 clinical features of AS, the probability of having this diagnosis is about 50%. But if the patient is also HLA-B27 positive, then the probability of having AS increases to 80 to 90%. More importantly, a negative test of HLA-B27 will reduce the probability of AS to a very low level. Now, let's talk about markers of inflammation, such as sedimentation rate or C-reactive protein. Elevated C-reactive protein is seen in approximately 40% of patients with AS. However, a normal CRP or C-reactive protein or a SED rate does not exclude a diagnosis of AS. What types of imaging are used to diagnose AS? In rheumatology, we rely on imaging studies a lot, especially when we suspect AS. First, we get a plain X-ray, most of the time to look for sacroiliac joints inflammation. Sometimes the plain X-ray is enough to diagnose AS. However, in some cases, the X-rays are not sensitive enough to pick up inflammation. And in those cases, we will get an MRI of the sacroiliac joints. The MRI can show different changes, such as bone marrow edema that is actually suggestive of active inflammation. How do doctors make the diagnosis of AS? To diagnose AS, rheumatology doctors use a combination of clinical, laboratory, and imaging findings. In 2013, the Spondyloarthritis International Society proposed an algorithm that we use in clinic, and that will be explained in my next video. We will always consider multiple aspects, like what is the patient age, when was the time of onset for the back pain, and if the patient has other clinical symptoms such as heel pain or dactylitis, as we said, saucy digits, if the patient had inflammation of the eyes, or if the patient has an elevated C-reactive protein. All these clinical symptoms that you might have, together with a positive family history of AS or with positive X-rays or MRI results, will make the diagnosis of AS. I hope this video answers many questions for you. If you are concerned about ankylosing spondylitis or another disease of your back or joints, please consult a specialist that will evaluate you and give you a proper diagnosis and treatment. If you like the educational content of these videos, please don't forget to like, share, or subscribe to my channel. Thank you.
rheumatologist OnCall.com